A Minnesota state senator says officials are asking doctors to fill out death certificates with diagnosis of COVID-19, whether the person died of it or not. Valley News Team's Callie Hubbard talked to the lawmaker today, who says fear may be coming into play.
Minnesota Senator and Dr. Scott Jensen says he received a 7-page document from the Minnesota Department of Health on how doctors should go about filling out a cause of death certificate. The letter from the Minnesota Department of Health gives advice to physicians, physician assistants, and others who certify deaths. The doctor says the letter takes you to a CDC website that has recommendations on how to include COVID-19 as a diagnosis for someone who was never tested for COVID-19.
Say I have a nursing home patient who's frail and 88 years old and comes down with a cough and a fever, and after 3 days ends up passing away from pneumonia. I'm not going to put influenza on that death certificate. So I doubt that I would be inclined to put COVID-19.
Dr. Jensen says each state's reported death numbers are making a lot of people fearful, adding that getting the number right is critical, especially during a pandemic.
I worry that sometimes we're so darn interested in just jazzing up the fear factor that sometimes people's ability to think for themselves is paralyzed if they're frightened enough.
One of the scenarios listed under the CDC guidance for certifying deaths due to coronavirus says, although no testing was done, the coroner determined that the likely underlying cause of death was COVID-19, given the patient's symptoms and exposure to an infected individual. So is the Minnesota state data reliable?
I don't think I have any position to question that per se. I know that I have talked with nursing staff who have been involved with people who have passed away that had either living wills or were on hospice care. In some of those situations, I've been led to believe that there may have been a COVID-19 diagnosis included on the death certificate document without having had a COVID-19 confirmed laboratory test, but I don't have any way to confirm that myself.
He says the public isn't stupid, and if you start messing with numbers, you're going to wish you didn't. In the FM area, Callie Hubbard, Valley News Live.